Good day, everyone. I am Aliana May Manzan Ignacio from BSN 13, and I am here to discuss one of the nursing theorists for the theoretical foundation of nursing. So, the theorist that I will be discussing for today is none other than Nola Pender. There are 4 points or topics that we will be encountering for today's video presentation. Number 1 is the short or brief introduction and background about Nola Pender. Number 2 is the discussion of the theory itself. Number 3 are the assumptions, strengths, and weaknesses of the theory. And number 4 is the meta-paradigm of the theory. So without further ado, let's get started. Who is Nola Pender, you may ask? So, Nola Pender was born in August 16, 1941 in the United States of America. Fun fact, she was still alive and well and now aged 80 years old. So, she is a nursing theorist, an author, and an academic. So, a little background about her profession. So, she is a professor in nursing in University of Michigan. She also wrote a book entitled Health Promotion in Nursing Practice that was first published in 1982 and was republished in 2002. Lastly, she created the health promotion model theory that makes her a nursing theorist. So with that, let's go to the discussion of the health promotion model. So the health promotion model composed of three words, which are the health, the promotion, and the model. So when you say health, the first thing that comes to your mind is the well-being of a person, the lifestyle she or he has. So the promotion, the first thing that I think of promotion is the advertisements, whether it was on the television, it was printed or online. Promotion is the spreading information to many people all at once. Lastly is the model. Just like what you are seeing right now in the presentation, the model is like a diagram, a concept map, where it helps the readers or the students who are reading to understand the topic, the lesson in an easier way. So what is health promotion model in general? So we can say that the health promotion model are the advertisements or the promotions that the government or that the doctors, nurses uses to promote or to advise their patients or the people in general how to take care of themselves, what health care they should do, and what they should practice at home and when going outside. So with that, I will be showing you two commercials from DOH that can be connected to the health promotion model. So this is the video number 1. Cheese, may BBC magbe. Tama na ang cheese. Pag nag-toast, hindi nagagamot. Alam na po ang gamutan, tutok sa pag-inom. Araw-araw, at healthy lifestyle, mainat. Nag-dance every day, kasi healthy all the way. Alas, ikalat ang balikas. Si Mang-Ben kumaling na. Dance okay talaga, ibalita sa iba. BBI, tulkuhan. So the first video is done. Now let's go to the second video.
Malinis na tubig ang dapat inumin. Yan ay tiyakin pati tubig sa lutuin. Gamitin palagi ang chinelas. Gumamit lang ng toilet, huwag kung saan-saan. Bulate, iwasan, maghugas ng kamay. Bago at matapos na kumain. At pagkatapos gumamit ng toilet, tugas-tugas ng kamay. Kaibigan, mga bulating pasaway. Goodbye!
So now we are done watching the commercials that was provided or posted by the DOH of the Philippines. So with those two commercials that you watched, what are the things that you find in common that they do to promote healthcare of many people? So yes, you are correct. So in those videos, we can say that number 1, the song is catchy. So with that, not only the children who can listens or who listens to those songs apply it to their minds, but also the adults who supervises them. So other one is that it is short. So each commercial is just 30 seconds long. With that, they should be straight to the point. So these commercials that we watch can be connected to Nola Pender's theory, which is health promotion model, since this caters different approach, different strategies and techniques to different people. So just like what is the reason why the health promotion model was created is to give a new path for healthcare or to focus more on healthcare of different people. Since we all know that different people have different characteristics, backgrounds, experiences, and education, there are things that differs from person A to person B to person C to person D to any other people that lives on this planet. So for example, patient A and patient B are both hospitalized because of the same reason. Di mo naman pwede sabihin na kung anong gagamitin mong treatment kay person A is yun din yung gagamitin mong treatment kay person B. Kasi different people tends to have different choices. Maybe person A has different beliefs than person B. Maybe person B has different traditions than person A. So, there are still differences in techniques and strategies of nursing that the patient was given by the doctor and the nurses in the hospital. Moreover, the health promotion model tends to help the nurses to have knowledge and to determine the major determinants that can affect on how they should nurse a patient in the hospital. So, determining that or having to accomplish that thing should have a desirable result. So, this result should have the improved health, enhanced functional ability, and better quality of life at all development stages. So dahil nga parang nabigay na lahat, may pagkakaiba man sa patient A at patient B, dapat naging positive din kasi marami tayong binigay or marami tayong kinonsider na factors na makakaapekto sa pagtulong o pag-nurse sa patient A at patient B. So sinasabi din sa model na to na ang health promotion model is the complementary counterpart to models of health protection. So pag sinabi mong complementary counterpart, it contradicts but in a positive way. It also states that the health is a positive dynamic state and it is not an absence of disease. So ang health at well-being ng isang tao is not the same thing. So masasabi dito, so sinasabi na ang health promotion model have three major components or three areas. These are the individual characteristics and experiences, the behavior-specific cognitions and affect, and lastly, the behavioral outcome. So this is one of the three major components or three areas of the health promotion model. So kapag sinabi mong individual characteristics and experiences, ito yung parang personal na experiences ng isang tao. It is subjective. Since hindi naman to nararanasan ng marami or ng lahat, ito ay nararanasan or nararamdaman ng iisang tao lang. So kaya ang under nito is the personal factors. So such as the biological factors, the psychological factors, and the socio-cultural factors. So sa biological factors, nandiyan na yung age, yung gender, even the body mass index of a person. Also, the agility, the balance, the aerobic capability, ganon. Next is the psychological factors. So, psycho, sa utak yan. This can be connected to your self-esteem, self-motivation, and your personal competence. Lastly is the socio-cultural factors. So, pag socio-cultural factors, nandyan yung social and culture. So, nandyan masasabi mo yung education, yung race, ethnicity, and also yung status mo sa lipunan. Next is the behavior-specific cognition and effect. So, sinasabi dito na meron daw tong 6 points, which includes the benefits of action. So, pag sinabi mong benefits of action, ito yung parang magiging result, magiging outcome. Next is the barrier of action. Ito yung pwede mong maranasang problem, yung personal costs, yung real blocks. Ito yung mga naghihinder sa'yo. Next is the self-efficacy. Sinasabi dito, it is the personal capability to organize and execute a health-promoting behavior. Ito yung ugali mo para suportahan yung sarili mo para lalo kang gumaling or para gumaling ka kung ano yung kinakaharap mo na sakit. Next is the activity-related effect. So, sinasabi dito sa part na to that it is subjective. It depends on how you feel, what is your thoughts, what is your experiences during the health promotion behavior or the health promoting behavior. Next is the interpersonal influences. So kapag sinabi mong interpersonal, it is the communication you have towards other people. In those communication or in those conversation that you have with other people, whether it is your friend, your family, or even a stranger, they tend to influence your thoughts and your actions. So, dito makikita yung perspective mo towards the health-promoting behavior. It can change your attitudes, your beliefs, and behavior. So, last is the situational influences. So, pag sinabing situational, it relates to your location and to the things that you experience to your surroundings or in a particular place. Dito makikita mo yung aesthetic features ng environment and demand of characteristics. So the last major components of health promotion model that we have is what we call behavior outcome. So, kapag sinabi mong outcome, resulta, di ba? So, malapit na tayo matapos kasi magkakaroon na ng resulta eh. So, this component has 3 points. One of which is the commitment to plan of action. So, in this point, it is the identification of the strategy that a nurse or a doctor or any healthcare providers use to implement the health behavior. Next is the immediate competing demands and preferences. So kapag sinabi mong competing demands and preferences, it is the alternative things that you can do to a patient as a nurse or as a doctor. So for example, patient A and patient B wants a snack. So in patient A, you give them an apple and they ate it. In patient B, you give them an apple just like patient A, but they don't want it. So the competing demands is the alternative. With that, the alternative snack that you give to patient B is a sandwich. Lastly is the health promoting behavior. So eto na yung matatawag na end. Kasi dito parang may nagawa ka na, may result na nangyayari, naging positive naman yung resulta, naging masaya naman yung patient. So kapag masaya ang patient, masaya rin ang healthcare providers such as nurses and doctors. So in here, it is a personal fulfillment. It is a productive living. Next, let's talk about the major assumptions of the health promotion model. So the number one assumption is individual seeks to regulate their own behavioral actively. So a person such as patient, nurse, doctors, or even the family members of the patient have the right to show and express their behaviors, their feelings actively. Number two is individuals in all their biopsychosocial complexity interact with the environment, progressively transforming the environment and being transformed over time. So, pinapakita dito na ang environment can affect a person since an environment and a person can interact with each other. The third assumption is that the health professionals constitute a part of the interpersonal environment which influences person throughout their lifespan. Gaya nga ng na-explain natin kanina, ang interpersonal is communicating with other people. Since pag napunta tayo sa ospital, pag napunta tayo sa center, makakapag-interact tayo sa mga health professionals, makaka-affect yung mga advices nila, mga facts na binibigay nila sa atin, ideas, opinion, makaka-apekto yun sa buhay natin and paano natin makikita yung pagiging healthy natin as a person. Paano natin pahalagahan, paano natin pagbibigyan ng tuon, at kung paano natin mame-maintain yung pagiging healthy natin, yung health natin in general. So the fourth major assumption is self-initiated reconfiguration of person-environment interactive patterns is essential to behavior change. So, yung pag-interact natin sa environment or yung pagiging social natin, dapat sinisimulan natin yan as a person or as a patient if we have an illness and we needed help with um, the health professionals. Dapat nagsisimula sa atin kasi kung hindi yan magsisimula sa atin, walang magbabago. There is no behavior change. Next, let's talk about the strength of the health promotion model. So one of the strengths of the health promotion model is that it is simple to understand. Just like I said earlier, I explained it in a simple way. But if we dig deeper to it, it shows its complexity in its structure. So kapag tinignan mo lang na siyang siya lang, kung ano yung parang simple meaning, madadalian ka. Pero kapag parang may mas gusto ka pang alamin, may gusto ka pang bungkalin, may gusto ka pang malaman, totoong mahihirapan ka. Next is that Pender's nursing theory focus on health promotion and disease prevention, making it stand out from other nursing theories. So dito, pinapakita nito na hindi pa nangyayari yung disease, may solusyon ka na agad, may result ka na agad na pwede mong gawin if ever man nangyayari yung disease na yun, di ba? Mape-prevent mo yun, may healthcare ka na may alalaman, and mapopromote mo yung health, hindi lang para sa'yo, pwede rin sa family mo, pwede rin sa friends mo, and pwede yung mga tao na nakapaligid sa'yo sa community nyo. Next is, it is high applicable in community health setting. Gaya to nung napakita ko sa inyo na commercial kanina, na dalawang commercial galing sa DOH. So, it is a community health setting. Nangyayari siya sa isang komunidad at malalaman siya ng maraming tao. The more people that has knowledge of how to prevent the illness or what healthcare they should do to avoid it, the more na makakatulong yon sa community health ng isang lugar. Last is that it promotes the nursing profession's independent practice, being the primary source of health promoting interventions and education. So, yun nga, mako-connect din to natin sa commercial na pinakita ko sa inyo kanina. So, yung commercial na yun is galing sa DOH. Pinapakita yon na ang DOH is the center or is responsible para may bigay na information sa bawat Pilipino. So, in here, makikita na independent yung pagiging DOH or independent yung pagiging doktor, pagiging nurse. Kasi sila yung nagbibigay ng advice, ng nagpo-promote ng healthcare, at nagbibigay tulong sa mga mamamayan. On the other hand, meron din namang weakness, yung theory. One of these is that the conceptual framework contains multiple concepts which may invite confusion to the reader. So, nasabi kanina na madali siyang intindihin. Pero dahil nga sa sobrang daming points, maraming details na kailangan pasukin, pwede siyang mag-confuse. Hindi lang sa reader, kundi sa mga mamamayan na pwede makabasa nito. Lalo na sa mga tao na hindi talaga nag-aaral ng nursing, na gusto lang matuto kung paano mag-prevent ng illness, paano mag-avoid ng disease, mahihirapan sila kasi maraming terms, maraming details na hindi mailalaman agad ng layman. Next is that its applicability to an individual currently experiencing a disease state was not given emphasis. So dahil nga ang theory nito ay nagfo-focus lang kung paano ma-prevent, kung paano ma-avoid, wala dito yung solusyon kung sakaling nagkaroon ka na. Now, let's go on to our last topic, which is the metaparadigm. So the metaparadigm divides into 4 subtopics, which is the person, environment, health, and nursing. So the person of the metaparadigm in the health promotion model is related to personal factors and prior behavior, socio-cultural, physical, biological, and economic components. So dito, makikita natin yung influence na mabibigay ng family, ng friends, and even yung mga healthcare providers na tumutungkol sa health promoting behavior. Next is environment. Environment talks the internal and external factors and how it affects the decision in personal health. So dito, matatakal yung outer environment or external factors such as yung nutrition and vegetarianism. Next is health. So, health is related to the level of personal, physical, and psychological illness and wellness. So, itong health ay directed towards your lifestyle. Kung may gusto ka mang baguhin, kung may gusto ka mang i-improve, kung may gusto ka mang alisin, pwede. Because this shown by links, relations between different parts of the scheme. Lastly is nursing. So nursing was represented by nurse. Nurses should show considerable influence on the formation of healthy behaviors. So they should be knowledgeable and give proper assistance to the patient in order to have an health-oriented actions. So nasa sa kanila talaga yung way para matulungan yung patients. Paano sila gagaling, paano sila magiging malakas ulit. So with that, um, I would like to say thank you for listening and see you guys again on my next video. Again, I'm Aliana Mimonzon Ignacio from BSN 13 saying goodbye!